Welcome to Ulosca channel. Access all nursing practice questions. Proctored cardiac and respiratory practice questions and answers.
Question 1. A nurse is caring for a patient with heart failure. Which symptom indicates worsening heart failure? A. Dry skin. B. Weight loss. C. Shortness of breath when lying flat. D. Increased appetite. Which one is the correct answer? The correct answer is C. Shortness of breath when lying flat. Explanation. Orthopnea occurs when fluid backs up into the lungs, making breathing harder when lying down, signaling worsening left-sided heart failure. Other symptoms like dry skin or weight loss are less directly indicative of heart failure decompensation. Question 2. Which heart sound is commonly associated with fluid overload and heart failure? A. S1. B. S2. C. S3. D. S4. Which one is the correct answer? The correct answer is C. S3. Explanation. S3 is an extra heart sound heard after S2 and is linked to rapid ventricular filling in a dilated ventricle, commonly associated with heart failure and fluid overload. It indicates decreased ventricular compliance. Question 3. A patient with COPD is receiving oxygen therapy. What is the safest oxygen flow rate to start with? A. 6 liters per minute. B. 8 liters per minute. C. 2 liters per minute. D. 10 liters per minute. Which one is the correct answer? The correct answer is C. 2 liters per minute. Explanation. Starting with low-flow oxygen is safe for COPD patients because higher flow rates can suppress their hypoxic respiratory drive, leading to CO2 retention and respiratory acidosis. Question 4. Which medication is typically administered to rapidly lower blood pressure in hypertensive crisis? A. Furosemide. B. Nitroglycerin. C. Lisinopril. D. Nitroprusside. Which one is the correct answer? The correct answer is D. Nitroprusside. Explanation. Nitroprusside is a potent, fast-acting 4-vasodilator that quickly lowers BP in emergencies. Other options like lisinopril act slower, and furosemide is more for fluid removal. Question 5. Which finding requires immediate action in a patient with pneumonia? A. Productive cough. B. Temperature of 38.3 degrees Celsius. C. Respiratory rate of 32 breaths per minute. D. Oxygen saturation of 95%. Which one is the correct answer? The correct answer is C. Respiratory rate of 32 breaths per minute. Explanation. A respiratory rate greater than 30 breaths per minute indicates severe respiratory distress or impending respiratory failure, making it a critical sign requiring immediate intervention. Question 6. Which ECG finding is most concerning in a patient with chest pain? A. Sinus rhythm. B. ST segment elevation. C. Premature atrial contractions. D. First-degree AV block. Which one is the correct answer? The correct answer is B. ST segment elevation. Explanation. ST segment elevation suggests myocardial infarction, which can lead to heart muscle damage if not rapidly treated. Other ECG changes like sinus rhythm or PACS are less urgent. Question 7. Which action should the nurse prioritize when a patient complains of chest pain? A. Administer antacids. B. Encourage deep breathing. C. Obtain vital signs and apply oxygen. D. Call the family. Which one is the correct answer? The correct answer is C. Obtain vital signs and apply oxygen. Explanation. Assessing vitals and applying oxygen helps stabilize the patient and identify if chest pain is cardiac-related, allowing for immediate intervention to reduce myocardial damage. Question 8. A patient is receiving a beta blocker for hypertension. Which adverse effect should the nurse monitor for? A. Tachycardia. B. Bradycardia. C. Hypertension. D. Tremors. Which one is the correct answer? The correct answer is B. Bradycardia. Explanation. Beta blockers lower heart rate and blood pressure. Excessive slowing of the heart is a known side effect and may require dose adjustment. Question 9. Which intervention prevents hospital-acquired pneumonia in ventilated patients? A. Keeping the patient flat. B. Deep sedation. C. Daily oral care with chlorhexidine. D. Avoiding physical therapy. Which one is the correct answer? The correct answer is C. Daily oral care with chlorhexidine. Explanation. Regular oral care with chlorhexidine reduces bacterial colonization in the mouth, decreasing the risk of ventilator-associated pneumonia, a common complication in ICU patients. Question 10. A patient develops sudden shortness of breath and unilateral chest pain after surgery. What condition does the nurse suspect? A. Asthma exacerbation. B. Pulmonary embolism. C. Bronchitis. D. Atelectasis. Which one is the correct answer? The correct answer is B. Pulmonary embolism. Explanation. Sudden onset of dyspnea and chest pain, especially postoperatively, is classic for pulmonary embolism, a potentially life-threatening blockage of pulmonary arteries often caused by clots.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.